Yeah.
Uh, Good afternoon, everyone. And today is a rare privilege for me to be live with one of my teachers, my mentor in facial aesthetic surgery, as well as someone who taught me how to start an aesthetic practice. And this was many, many years back in the year 2008. Dr. Patrick Tonnard, one of the world's leading authority in facial rejuvenation and also a lot of other plastic surgeries. I was a fellow with Dr. Tonnard at a center in Ghent, and I will absolutely be failing in my duty to acknowledge that today what I do here, he is very, very largely responsible for all of that. One of the most important things that I actually learned from him was the fact that we should write everything that we learn. And I remember he scolding me once because in my arrogance, I didn't write what he taught me, and he asked me something and I didn't remember. And that was something which has been in my mind throughout in the last 11 years. And that's what I tell everyone who's working with me today as well, because that has made me just absolutely freeze everything that I learned. So thank you so much, Dr. Patrick, for being with me today. And so while we were just starting, you mentioned about how you feel artificial intelligence might affect plastic surgery. So I'm going to hand this over to you because this is a very, very interesting topic and a lot of concern for people.
Well, I'm convinced that artificial intelligence and 3D printing and all kind of things will revolutionize our medicine. But I'm also convinced that in aesthetic surgery, and especially in facial aesthetic surgery, we will not we will not be replaced by industrialized techniques because of the very definition of aesthetic surgery being a physical action with a psychological effect that is very hard. I've written a little text because when you asked me to talk about my philosophy of working, it was also time to me, for me, it was a good moment to reflect on what am I doing, what is my message? And this is not something that you just tell in 2 minutes. So you have to think about it. And I wrote something down. And if you want, I will read it with you.
Please do.
It's
Please do.
the title of this little piece is Aesthetic Surgery, Manual Labor or Artisan Craftsmanship. So I consider myself as an artisan plastic surgeon. And this is a kind of philosophy of life. It's like I see my whole work as a repetition of creation attempts to create masterpieces. Like if you have a painter at the end of his life, what is his life? It's all the paintings that he made. And in some painters like Picasso, they were all masterpieces. Most of the painters, they have a few masterpieces and all the rest is average or less good. I think in surgery it's the same. It's that you can consider your whole practice as a continuation and the goal must be to advance in the art of the craftsmanship. And especially with regard to good aesthetic surgery, I think it should emit sensuality, beauty, balance, and authority. And then to obtain this, me in my personal practice, I use dedication, enthusiasm, and professionalism. And I also require this from the people I work with. That is very important because your work is a teamwork. You cannot do it alone. You are surrounded with nurses, even with the people who clean up the operating room. That's a team. And from all my people that I work with, I want to feel a desire that they want to work with you, with me or with somebody else. Eh? So this is something that dedication, enthusiasm, and professionalism, this is something that I require from the people that I work with. And because our treatment is a multifactorial team approach. Now, aesthetic surgery in general and facial aesthetic surgery in particular is a physical process with a spiritual component. And the patient is the vehicle for seeking out perfection, but that perfection is never reached. Salvador Dali has once said, "Don't be afraid of perfection. You will never achieve it." And that is something very nice. We were all talking about perfection. Actually, I'm interested in the beauty of the imperfect, which is, it's a kind of superior type of beauty. Yeah? I love the patina of wrinkles in the face. An aesthetic surgery, facelift, is not about wiping out all the wrinkles. It's about creating a delicate balance of all the aging aspects of a face. And when I'm talking about an artisan plastic surgeon, it doesn't mean that I just do things with my hands. It means knowing, and especially knowing the order of things that need to be done. You can close a surgical wound as an artisan or as a manual labor, a man who works with his hands. And these hands, that were the tools by the surgical barbers in the Middle Ages. And these tools one day will be replaced by 3D printing, by artificial intelligence, because these are the tools of the future. But for the artisan plastic surgeons, it's not, what is most important is not what we see, it's what we don't see. And especially the years of learning, which will result in the number of steps that you have to repeat in order to get the right technique so you can achieve the right result. Yeah? So every step is authentic and nothing is superfluous. It's like Antoine de Saint-Exupéry in his little book, the Petit Prince, the Little Prince. What he told is, it's what is most essential is invisible to the eyes. And if you want to perform an authentic personal facelift, you have to complete, let's say, 150 or 200 steps, each of which determines the result of the next step. And every little modification of every single step will bring you closer to, will bring you to a better or less of a less quality result. And every little modification has its influence. Understanding and mastering this, that it takes years of dedicated craftsmanship. And that is why aesthetic surgery will never be industrialized. This is why a single machine can never do the same job as a well-executed aesthetic surgery. A modern custom-made personal aesthetic surgery is very operator dependent, and it incorporates all the techniques and the surgical skills that the operator is mastering. And people sometimes they are shocked if you say my surgical fee is €5,000. They say, how long does it take? 1 hour? It's easy money. No, they don't pay you for the 1 hour. They pay you for all the learning that you did and for the mastering of all these little steps that you make it to a great result. And that is also why we should honor our predecessors who have contributed to our specialty. If we are able now to move our surgical results toward perfection, it's because we are standing on the shoulders of these giants. And in contrast to a traditional artisan craftsmanship, like, I don't know, a shoemaker or a baker, I don't know, our patients are alive, as is also the surgical result over time. And the skin, the subcutaneous tissue, they will change over time as a result of the continuing aging process. But most important is that the bond between the artisan surgeon and the patient, this is a bond that will never be broken, because patients will come back to you for maintenance, for skin improvement, or for regenerative therapies, because of this unbreakable bond between the patient and the surgeon. And this bond is called trust. And some patients will forget what you say, They will forget what you did even, but they will never forget how you made them feel. And that is what aesthetic surgery is all about. Now, when we have surgical fellows like you were more than 10 years ago, um, the first thing they want to know is technique. How do you do it? Eh? And the modern adagio is, I want it all and I want it now. Yeah. And this is it's very nice to be confronted with their enthusiasm and their eagerness, but it simply doesn't work like that. Eh? Now you realize that. Yeah. It is, I follow and I still follow many great plastic surgeons, and I learned 4 things. The first thing when you start is that you don't know. And that is easy because when you start, you quickly realize that you don't know anything. The second thing is harder to understand because it took several years to realize that you have to learn a lot. It's not something that you learn quickly, it goes slowly. And it took me years to understand that I started to learn. And that learning process is not just a passive absorption procedure where knowledge is offered you with a spoon. It is an active search for knowledge, for techniques, for experience, which is different in every single plastic surgeon. And it's based on an insatiable hunger, curiosity, desire to learn. The third thing I learned is the right technique. So technique comes on the 3rd place, not on the 1st place. And that is the most young surgeons, they want technique, technique, technique. That's not so important. But on the 3rd place is technique. Now, it's not always the technique that you learn during your teaching process that is the best for you. Nowadays, I do everything different than what I learned 20 or 30 years ago. Now, every aesthetic surgeon has his own style of surgery, and this style has to be found and incorporated into your own practice. And finally, the 4th phase is that of love. Love, not the romantic love, not the love of, but the love of giving something else what it needs. Yeah? There is only one 3-star Michelin star restaurant in Belgium, and their brand, their reputation with the sentence, the secret ingredient is always love. And that is the secret ingredient that I'm referring to in our plastic surgery kitchen. It's love. And that comes with the years. So,
interesting point you said was people today want to do it faster, but are you actually noticing this in the younger generation?
It depends. With the younger generation, it goes faster, but as I explained, it doesn't work like that. It works in many things, but perfection comes with practice and not with reading a book or with reading an instructions. It's through practice that perfection comes, and it's just not sharing techniques. It's different.
That's so let's just go back. When you started off, did you already know you wanted to be a plastic surgeon?
Well, it was, let's say you have 2 kinds of specialism for me, internal medicine and surgery. Yes. That's another mindset. Internal medicine, these people, they have time. They are confronted with a problem. They think, they do some investigation, they think again, then they have a differential diagnosis. Then when they have the diagnosis, they think about the therapeutic modalities. They have time. Yeah. We don't have time. If you cut a vessel, you have to do something. It's like a Formula 1 racer. He has to decide the right things on the right moment. It's a kind of reflexes. He has to go as fast as possible from one side to the other. And that's it. And this is kind of, if I was confronted with, when I was confronted with surgery, it was like, whoa, this is what I want. This fits me. I never had any doubt. And then I was in my second year of medicine, I was in the operating room of plastic surgery, and I saw my former professor doing a cleft lip, and that was so elegant. And I was just paralyzed. It's like an infection. I said, like, this is what I want to do. So it was a desire, it was a dream from the beginning, and I think this is also very important, in especially in this dark times like we're living now, is that you have to live your dream, because you have to have faith, especially now in dark times. You have faith. Faith is a state of mind that is induced by autosuggestion, and autosuggestion is something very powerful. Your mind makes your life, and because autosuggestion is like, it's a transmutation of your desire into something, into a physical equivalent, and that is very important. It was always for me. I always had a purpose, a dream to live towards, and then the next step, and then the next step, and that works for me. And I think that's important, and especially in these dark times that we are confronting now, it looks like in dark times we have to dream with our eyes open, and that is what we have to do. You really have to go on, and you will see that even if it's a dark time nowadays, there will be opportunities. There will be new opportunities, and it is typical for opportunities that they come disguised as and a lot of people don't see them, but you will see later on there will be new techniques. What we're doing now, we wouldn't do it a few months or a few years ago, because, well, now we have time, we have the tools, the internet, and we will do. You see, every day I have emails with new webinars and people sharing their knowledge on a different way. So that makes sense.
No, it does. And as you went into aesthetic surgery, now you innovated something which is dramatic in facial rejuvenation. I
I
think
don't think I say that I invented something. I just popularized.
Innovated.
Because if you go back, that's why I said it's important to honor the people that came before us, because there is not so much invented. People modify. I fell on an article of the 1934 by a French plastic surgeon, Virac. And he did actually exactly the same. He called it the bayonet incision, like this. And then he did the mind. He did a little 2 or 3 purse string sutures, very limited. And he said there were no pictures, were just drawings. And he said the results are very encouraging. And that's what we did. And then we just popularized it. We modified it. We did. We found some scientific evidence, explanations, and that's so and so on. And that's it. And we were just on the right moment. Sid Coleman didn't invent lipofilling. It existed already before, but he popularized it. And well, now everybody is doing it. So it's not something, there are not so many innovators. I think in plastic surgery, we have 3 kinds of surgeons. We have copiers, we have improvers, and we have innovators. Now, the most happy surgeons are the copiers. And I know surgeons who copy results of others who are perfect surgeons. They have perfect results, and they have an easy mind. But almost everybody wants to improve, has his own style, but real innovators are very rare, very seldom.
And in fact, when you said one line, the mind, what you believe will decide, and you actually believed in this process and you just stuck with this process. I'm sure you faced a lot of criticism initially, at least.
Yes, absolutely. Initially, I remember when we started presenting this in the beginning of 2000. My first breakthrough was on an ISAPS meeting, and there was Fuad Nahai as a moderator. So I presented this, and he, as a gentleman, he is always he said, "Well, this was an early result. Come back later and show us our long-term result." And then we did, and we showed results that had more or less the same stability as a classical smash facelift. And then what was nice that in the beginning, Fuad Nahai was a little bit skeptical, and he said, "I don't do that weekend facelift." But then late years on, he said, "Well, perhaps a small percentage of my population could use a short scar facelift." And then a few years later, he said, "Well, definitely there is an indication for, and that is for short scar facelifting." And that is very nice because as a man of his experience, he could still change in his mind, and that is important.
Someone like him being where he is, actually modifying his own surgery to a relative. So you would have been pretty young at that time. You're pretty young now as well.
I was, and also we were like 40, 45, and we in Belgium and in we are not used to boost our results. We are a little bit shy, and we are low profile, and that has been the key to our success, especially in the United States. We were honest with our results, we were low profile, we didn't say this is the best and all the rest is bad. We say this is just how I do it, and these are my complications, and these are my results, and I try to be honest, and that's it. So stay low profile, be honest, and I think this is the key to success.
Absolutely. Today, for someone who wants to start off with facelift, would you unhesitatingly say max lift is something which is an easy way to get good results?
Well, it looks very easy, but it is not easy.
It is not.
You have to be a fully trained plastic surgeon to perform a good short scar facelift, because you have to deal with dog ears. You have to be a soft tissue surgeon. It's not something. Oh, it's shorter. It's no. It's. I don't think it's easier. But if you start with the right case, a young patient between 45, 50, with moderate laxity, you will have a very safe procedure with a quick recovery and limited complications. But it's not a procedure for every patient. If you have a deteriorated neck until your sternum, you will not have a good result. You have to do more in the neck, and you have to incorporate and combine other techniques but for us, the max lift is still the workhorse that we start with, and then we combine a lot of other things.
And max lift, in fact, had the potential to incorporate a lot of other procedures.
That's it. Because it's limited in time, you can focus, and that is actually the subject of our latest, the newest book, the centrofacial rejuvenation. You can focus on eyelids, the fat grafting around the mouth, the lip lift, and so on things that for us is sometimes more important for some patients than the actual trying to get a perfect cervicomantle angle. It's the whole concept of centrofacial rejuvenation and the tightening in the neck that makes something natural and balanced.
And fat injection for you is a very, very important step.
Yes, absolutely. Deflation of the face is, especially in the central part where most of the mimic movement is a key for a good success. If you don't see the deflation and you don't correct the deflation, you will have a tighter face, but not a replenished, a fuller face. And this is something, if you don't look at it, you don't see it. But once you start looking at it, you see it in every aging face. That is why it is so important, why we ask our patient to bring in pictures when they were young. Tell this to your secretary. If a patient asks for eyelid surgery and for facial rejuvenation surgery, tell your secretary that they tell the patient to bring in pictures between 20 and 30. Patients think, oh, I don't want to be 20 or 30. No, but I can show them what has changed in their face. The deflation of the eyelids, the periorbital area, the malar area, the lips, the lengthening of the lip, the patient, they see that things are happening in their face, but they cannot really identify and define it. So you have to explain it. It's a very good educational tool that you can explain your patient. Many patients, if I tell them I have to put a little bit fat in your upper eyelid, they say, no, I don't want fat in my face. I'm already fat enough. But even patients who are full, have a heavy face, they can benefit of fat grafting in their face. So I think it's important.
And of course, and one topic which I know you really love, nanofat. And
Yes.
so it's the way to get the skin to really live.
Well, the nanofat, for instance, this is another issue. When we published the studies on nanofat in 2013, people were kind of laughing with us. Oh, these guys, they are shaking with the fat and they think it does something. Now, if you go to an important fat meeting like IFATs or something, well, a third of the meeting is about mechanical dissociation. And we also believed in it. That is, well, like your dream coming true.
Yes.
In the beginning, you clinically, you can see that something goes on there with the quality of the skin. And now there is a lot of place for research for the younger plastic surgeons about what is really happening, because we still don't understand what it is all about. Is it the cells? Because everybody's talking about stem cells now. Everything what you don't understand is stem cell.
Yes.
That's very deep, but sometimes it's a little bit wishful thinking, because there are a lot of other things involved. There are cytokines, intracellular hormones. They are the whole issue with the exosomes, very important. And now there are new studies, especially from China, that they inject a cell-free fat extract. So they remove all the cells and they see the same regenerative capacities of that extract than with the classical nanofat. So that is very important. Now the nanofat, we changed a little bit, practically we changed a little bit our the use of nanofat. The problem, if you want to inject it on a large surface like the whole face with a needle, if you incline your needle a few degrees different, you end up with a few millimeters deeper or more superficial. So that's why we're using the needling device nowadays. It's a little sterile vial with 20 needles of 1.5 millimeter. The vial is filled with nanofat, and then we needle the skin. We go up to the papillary dermis, so there is bleeding. So we know we want to be in the papillary dermis because this is the place where regeneration takes place. And then we needle the whole face, and then we wait for the result. Now, typically, you have to wait 6 to 8 months to start seeing a result. So that's why we're mixing the nanofat with hyaluronic acid, with a little bit Botox, with vitamin C, to have a sooner result of like a hyaluronic acid boost. And then when that result start to fade, it's taken over by the regenerative aspect. So that is interesting, I think.
That's a very interesting thing. And I'd seen you present that at one of the conferences, and that was something really interesting. We've been trying to do that as well here. Last thing, you seeing a lot of, you train, you teach so many students. Once the student comes out into practice, what should a person do today in order to achieve good success in plastic surgery?
Have trust and believe in your dreams. That is really, you have to make a plan. What do you want to be? Every fellow, perhaps you remember it, during your fellowship, I asked you, where you see yourself in 10 years? What is your dream? And some people are very dedicated. I want to do this. This is what I want. This is how I see my life evolving. And these are the guys who will make it.
Yes.
I'm sure. And if you just go with the flow, it doesn't work. You have to have a vision, go for it, and have the burning desire to realize that. And especially in times like this, like everything looks bad. It's not bad. It will. We will survive that, and have faith. Have faith in your dreams. That is the home take message, perhaps, of that talk.
And in fact, I think this is one of the best periods to start thinking, gaining knowledge, skill, and actually, so for example, we are working a lot on our own clinic systems, our own. So I think this is a great opportunity, once in a lifetime opportunity to build success today.
Absolutely, you're absolutely right, and you're one of the examples of it.
Thank you so much. No, I so fondly recall that, and there's just one thing which think, are you in Belgium also facing issues with non-technically qualified doctors practicing cosmetic medicine and surgery?
Not too much, fortunately, but I see in other countries, like in Holland, in France, there are non-medical. Well, they call themselves like skin therapeutics, and they try to be. They do Botox, they do fillers. In Belgium, it's not that bad, but still, I have nothing against a professional doing injections as long as he is doing it well. That is the art of our profession. That if something goes wrong, that we know what we have to do, that we can help our patient. But in Belgium, is it in India a big problem?
It's very bad in India,
Yeah,
especially fields like hair transplant. Today, hair transplant is being done by non-doctors as well. And
yeah.
unfortunately, it's a big menace. Today, we have liposuctions and breast implants being done by non-plastic surgeons. And it's
Well, yeah, the only way to defend yourself is to deliver
better
high
results.
quality result. That's it. And they will learn. The people will learn that you shouldn't go to that kind of unprofessional um, whatever, who is not qualified, and they have to they will. Yeah, I also meet people who have been. Um, Recently, I had an orthodontist who, a woman who had a facelift done somewhere in North Africa, and I asked her with terrible result, terrible scars, untreatable. Um, I asked her, why did you do it? And she said, and she was a medical professional. She said, because it was cheaper. So that is an emotional decision. That's not something that decision was not taken with her head. And that is, people will learn from it, for sure.
And
And
you still,
sorry?
no, please continue.
No. I was thinking, people say, sometimes they say, uh, well, your surgery is expensive. And I say, well, if you think my surgery is expensive, wait until you are treated by crook, and then see what happens to correct it. Then we'll lose more money.
You still maintain the hunger to innovate and innovate more.
Well, it's something you can't stop.
No, I can't. No
It's a
one can stop you.
it's a mindset, and it's. I'm always I'm never happy. When I see a result, I can always see a patient, even if the patient is very happy, I can always see, oh, I could do this better. And this is also a mindset. If you are happy with everything, and oh, if my patient is happy, I'm happy. I can always see little details that have place to improve. Yeah.
And that is the reason why you're amongst the world's best teachers today. And I can simply not thank you enough for being there for me. I have written so many times to you and you've always responded back. I will remind you of one incident. You were here in India some time back and you had breakfast at our house, and my wife had made some chilies for you. It was a very spicy thing, and you could not stop eating even though you were all red and sweating. and but you just could not eat it. So that was for me an amazing moment.
It made me think of my fellowship in Mexico, where I
Yes.
eat a lot of chili, and I love it. I have a kind of love-hate relationship with chilies. I love them, but they bite me.
So thank you so much for spending so much of your time today. I'm really, really grateful and really appreciative. So many things that you said, I'm going to now bring that out and pass this message on of creating a dream and living by that dream, because that
Okay,
truly is the only way to succeed.
perfect.
Thank you
Thank
so
you.
much.
And if you want my text, I can send it to you.
Please do. Please do. That will be really helpful.
I will. Bye bye.
Bye bye.